This is All India Radio Mangalore. Dear listeners, in today's Talk in English program now, Dr. Sajjan Shenoy, Rheumatologist, will speak on the topic Joint Pain, a Warning Sign.
Before we go to the main topic of rheumatoid arthritis, I would like to address the issue of what is rheumatology, because not many people have heard the word rheumatology. So rheumatology, the word rheuma is actually derived from ancient Greek, where rheuma means river. So initially, when patients with joint pains and similar symptoms used to come to the doctors, they were really confused as to the origin of these diseases. It appeared as if the diseases and those symptoms flow or moved like a river from one joint to the other, from one organ to the other, and hence they gave the name rheumatology, which means the study of diseases which move like rivers. Essentially, they were referring to multi-system diseases and autoimmune diseases. So the topic of discussion today is rheumatoid arthritis, which is one of the most prevalent diseases which is seen under the heading of rheumatology department. In rheumatoid arthritis, the essential symptom is that of joint pain. I am sure that all of us have experienced joint pains at some point of time in our life. So it is not something that we have not experienced. But we also know that these joint pains that we have experienced have not been serious. They have recovered on their own. So in that situation, we need to understand how these patients with rheumatoid arthritis are different from that of the general population and how their joint pains are different from that experienced by the general population. To begin with, we will just discuss how big this problem is of that of rheumatoid arthritis in our society. To give you an overview, rheumatoid arthritis affects about 1% of the population. That may look like a very small number, but when you apply it to our huge population, it becomes a really big number. For example, if you just consider the 5 neighboring districts that we have around Dakshina Kannada, with a total population of approximately 65 lakhs, we end up having 65,000 to 1 lakh patients of rheumatoid arthritis who are suffering for many years. So that is not a small number by any means. So as a result, it is of great public health importance for us to know about this disease. The second thing we need to understand is that this can occur in any age group. The typical misconception about arthritis or joint pains is that it typically occurs in older age group, 60 plus age group, but that is not true. It also occurs in children starting from the age of 2 all the way up to the age of 100. So how is this joint pain different from the usual joint pains that we experience? The joint pains that patients with RA, I will use the term RA for rheumatoid arthritis as a short form. The patients with RA have inflammatory joint pains. What is inflammatory joint pain? It is a type of specific joint pain where there is inflammation in the joints. Inflammation means swelling of the joints, which is an internal swelling, which may or may not be seen outside. Typically, these patients have joint pains involving multiple joints, small and large. For example, the finger joints, wrists, shoulders, knees, feet, neck, low back, and so on. And the joint pains are usually worse in the morning hours and after periods of rest. In comparison, the typical joint pains that we have experienced, like a common person would have experienced, is after working. When I stand for a long period or I run for a long period, I might develop joint pains. But patients with RA have joint pains even when they are at rest. In fact, their major complaint is that they have the worst pain in the morning hours. And as the day progresses, the pain may slightly reduce, but usually does not become zero. At the same time, they also complain of significant stiffness. Early morning stiffness is the classic term we use in these situations, where the patient has got stiffness lasting for about more than 30 minutes in the morning hours. So this stiffness means that the patient has got difficulty in moving the joints. So they are unable to make a fist, they are unable to bend their knees, sit down in the toilet in the morning hours, they are unable to do their routine activities, even simple ones like buttoning their own shirt or making a cup of tea or eating with the use of a spoon. So life becomes very difficult for them during this period. So that is the second symptom, which is early morning stiffness. The third is that once this early morning stiffness and pain keeps on progressing, they ultimately develop swelling of the joints, which is usually noticed by the patient, often also noticed by the family members and the friends of that patient. Now, if those patients do not take this seriously and they do not get treated during this period of time, which is the early period of this disease, they typically end on with deformities. Deformities means the joint gets damaged by the disease process, which has been going on for many months or years. And ultimately, we have deformed or bent joints. In technical terms, we call it osteoarthritis of the joints or damaged joints. In simple words, we can say that the bones which make the joint are damaged and hence become grotesque in appearance and bent. And once the joints are bent, then it is obvious to everybody that the patient has got a joint-related disorder, usually RA. And once the deformities happen, usually of the lower limb joints, of the hand joints, the life of the patient becomes pretty difficult. You can imagine that if a person's knee joint is completely damaged or a hip joint is completely damaged, he or she may not be able to perform basic work of life like walking, sitting, waking up, and doing routine work. If untreated, rheumatoid arthritis also can affect other organs other than the joints. For example, the eyes, where we can have serious vision-threatening complications. We can have complications involving the lungs and the respiratory system, which we term as interstitial lung disease. We have also complications involving the heart, that is heart attacks and stroke. In fact, the most important cause for mortality or the cause for death in such patients is actually heart attacks, which are an end stage of chronic inflammation that is going on in the body. They also tend to develop many other skin-related and nerve-related problems if untreated. So, we now know that RA basically involves all the systems, joints and otherwise. So, it is very interesting to know how this happens, because the next question that immediately comes into our mind is why this happens and how this happens. This is due to a process called autoimmunity. Auto means self, immunity means an immune response. So, in autoimmunity, essentially the problem lies in the fact that the immune system in such a patient, which has been designed for his or her protection, is attacking her own body. This is a serious situation akin to an army staging a coup against a civilian government. And in such situations, the defense is very minimal with respect to the civilian population. Similarly, the immune system, when it acts against its own body, is a very potent system which tends to cause maximum damage. And when this autoimmunity occurs, it usually will not spare any organ because our immune system has got the freeway or the leeway to go into any organ. Why does this autoimmunity occur? Well, that's a very difficult technical point to answer in an easy way. There are a lot of studies and there are a lot of research going on as to why autoimmunity happens. It has been observed that autoimmunity typically occurs in women in much more prevalent fashion than men. Although that's not always the rule, there are diseases where men have more autoimmunity, but then women tend to have more autoimmunity overall. Autoimmunity is also linked to smoking, so people who do smoke tobacco in the form of cigarettes, BDs or chewing of tobacco tend to have more autoimmunity. There is also a strong genetic component to this. Patients who have family history tend to have more autoimmunity. So once we have these kind of symptoms, then the next question is, who is going to diagnose this? Whom should a person with these symptoms see? Usually the recommendation would be to see a good physician or a rheumatologist and an immunologist. Who is a rheumatologist? A rheumatologist is a person who is trained in the diagnosis and treatment of these kind of disorders. So when a patient sees such a doctor, a physician or a rheumatologist, the doctor would examine the patient, which is the most important part of the whole episode, and also do some basic tests. I am sure that a lot of people would have heard tests like rheumatoid factor, ESR, a complete blood count, and so on. So these are the common tests which we do in a patient with rheumatoid arthritis, and usually majority of them have rheumatoid factor or RF positivity, which defines the disease for us. Of course, there are many other tests that can be done which will be decided by the doctor who is examining the patient. There are tests like anti-CCP, anti-nuclear antibodies and so on, which are highly sophisticated technical tests which need to be done only in the supervised labs. So once the diagnosis is done and the doctor diagnoses that this particular patient has RA, what are the options? One major misconception among the public is that there is no treatment for arthritis in allopathy and hence we need to do alternative complementary medicines, which is absolutely not true. In fact, in today's world, we have so many medications for RA that the number even beats that which is present for diabetes and so on. So we can start with simple drugs like methotrexate, hydroxychloroquine, sulfasalazine to name a few. There are many newer drugs also which work very well. Another common misconception is about the use of steroids. A lot of people think that steroids are a must and once we start steroids there is no end to this and the patient is stuck in a perennial loop of steroid therapy. This is also not true. In fact, today's management with an appropriate medical management with other drugs, what we call as DMARDs, DMARD, disease modifying anti-rheumatic drugs. So if a patient adequately takes DMARDs and controls his disease, then steroids can be withdrawn within 3 to 4 months. In fact, it is our target in all patients to withdraw steroids within 3 to 4 months of its usage. So clearly, we can bring the disease under control and keep it under control over the long term without steroids. There are also many new medicines which come under the category called biologics, where we use injections also to control the immune system dysfunction and to treat the disease. Overall, if we think about it, the major target of treating such a disease is to keep the disease under control so that the person who is suffering from the disease remains normal without any pain, stiffness, swelling or deformities, and to prevent complications of the disease that we just listed. So in such situations, if the disease has been adequately controlled, the patient usually will a near normal life, and in fact we would be happy to say that the patient himself cannot feel that he has a joint related disease. He should be able to undertake all activities including physical and professional related. So we always encourage the patients to do adequate exercise, take part in sports and pursue whatever their dreams are. We have patients from all walks of life, starting from people who work in the offices like clerks or doctors and so on, to people who work in the field like agriculturists or coolie workers or person who does active field work like police or teachers. In such situations, we encourage them that they should do their routine work diligently and with full fervor. If by chance that a patient doesn't come to our attention early and then accumulates joint damage, then of course we have the option of surgical treatment in the form of joint replacement. We can do a total knee replacement, we can do hip replacements. But then ultimately our focus and target is to prevent this. We need to treat the disease and prevent joint damage so that we never reach a stage where we have to talk about joint replacements. Finally, I would like to conclude with specific emphasis on a couple of misconceptions that is very prevalent in the society regarding joint related disorders. Another important misconception is that people who have arthritis should not marry or should not plan pregnancy. Again, this is really a wrong statement to make. In today's world, with adequate disease control, all our female patients, that is ladies, can plan pregnancies, can plan marriage and have a perfectly normal maternal life. However, it has to be emphasized that the disease has to be controlled adequately during this whole period. People think that diet is closely related to arthritis. So foods like yogurt, ice cream, non-vegetarian food, meat will worsen arthritis. This is a common misconception, which is not true. If adequately controlled and the disease is under control, the patient should be able to eat whatever he wishes. In fact, there is no dietary control at all in patients who have rheumatoid arthritis. Rheumatoid arthritis is very common in the society. It is just that we need to open our eyes and recognize the symptoms that is around us. So the symptoms of joint pain, swelling, stiffness, plus or minus joint damage and deformities should alert every one of us to the possibility of the presence of RA and seek medical attention right away. Because the most important keyword here is early diagnosis, appropriate treatment and prevention of deformities.
Dear listeners, you have just heard Dr. Sajjan Shenoy, rheumatologist, speaking on the topic Joint Pain, a Warning Sign. This broadcast came to you from the studios of All India Radio Mangalore.